So good morning, everyone. Welcome to the Gazette's Iowa Ideas Conference. I am Vanessa Miller. I cover higher education for the Gazette. I've been doing that for about a decade. And this is the Access to Mental Health Resources session. This is within our education track of this conference. And in a minute, we're going to just have the panelists that we have with us today introduce themselves and jump right in. Before that, I want to thank our sponsor, Kirkwood Community College, for sponsoring this track specifically. And I think we're going to watch a little short video from them right now.
Hello, I'm Lori Sundberg. I'm the president of Kirkwood Community College, and we are proud to be a sponsor of this year's conference. The Iowa Ideas Conference brings educational sessions on a variety of topics to Iowans from all over the state. It is a terrific conference, and we are proud to be a part of it. I hope you enjoy your time at the conference. Thank you.
Great. Well, thanks. So yeah, I think we're just going to start by having our panelists introduce themselves and just share a little bit about their work in terms of mental health and mental health resources for K through 12 and higher education campuses. So yeah, let's start with you, Alyssa.
Hi, my name is Alyssa Dubé. Before I go too far, I want to let you know, Vanessa, that Barry is stuck on mute. So if somebody can help him, that'd be great.
I see that. Yes.
Yeah. But my training is as a licensed psychologist in Iowa. I am the clinical director for the Scanlon Center for School Mental Health, and I'm also a clinical associate professor of counseling psychology at the University of Iowa.
Great, thanks. Yeah, go ahead, Barry.
Okay, I got off mute.
I can speak, I know.
Yeah. I'm Barry Schreier. I am also a faculty member in the doctoral program in counseling psychology at the University of Iowa. I was previously the director of the counseling center on this campus for 7 years and made my previous 30-year career in campus counseling centers across the Midwest and the East Coast. And I am now the director of the higher education program in the Scanlon Center for School Mental Health in the College of Education at the University of Iowa.
Great, thanks.
All right, I think I'm last. So I'm Opara Rice, CEO of Tanager Place here in Cedar Rapids, Iowa. I'm also a member of the State Children's Behavioral Health Board, tasked with trying to design a system for young people and young adults. I'm also a proud member of the Scanlon Mental Health Center advisory board as well. It just had our meeting a couple days ago. And also in my other life, I'm an adjunct professor in the School of Social Work for University of Iowa too. So happy to be with all of you today.
Yeah, great. Thank you guys for being here. And I'm just so thankful to have so much expertise all together to talk about this. So I guess I thought maybe we could start by just kind of laying the landscape. Mental health issues and resources, it's a super broad topic and issue, but I wondered if you guys could start by just talking a little bit about where we are. I know, this was a big issue before COVID, then COVID came and that affected a lot of things. So where are we today?
Well, that's a really big question, Vanessa. I would say it was a big deal before COVID. I think COVID just really highlighted again the vulnerabilities that everyone has, right? It touched everyone's life, and I think it changed the conversation around the importance of mental health and the importance of connection and trauma. And I think that it continues to be a major concern today. But I do think there are a lot of really smart people coming together, crossing different sectors to try to help solve some of these issues and deal with some of the system gaps.
Yeah, I would 100% agree with that. The metaphor I like to use is that things were certainly at simmer for a long time, and the pandemic came and turned simmer up to boil. And just sort of added and certainly pointed out vulnerabilities and disparities in terms of how these things fell across people and the access that people had to resources and whatnot. The other thing that I think is really critical for us to make sure we get on the table early is, for sure, people are struggling, and doesn't take much effort to get exposed to the reports and information from the media about how much everybody is struggling, that depression is up and anxiety is up and suicidality is up, and all that has modicums of truth to it for sure. From a higher ed perspective, there is a really nice survey that is done every year across campuses, and campuses can elect to do it, but hundreds of campuses do it. And what they show basically in the survey is that around 20 to 30% of college and university students will endorse symptoms of depression and anxiety, and those numbers have gone up since the pandemic. And that's often what gets reported. And so that's what students get exposed to and are told about their mental health. The other data that's out there that doesn't get reported as much is they ask the same students often, please endorse signs of flourishing. Are your relationships good? Do you feel like there's purpose to your life? Do you feel like you make positive contributions? And while the numbers are 20 to 30% overall nationally on students who endorse symptoms of anxiety and depression, students in the 70s, 80s, and 90s percentages endorse flourishing. And so we're aware that students are struggling, but we're less aware that the students actually are doing well on a lot of things too. And just because someone is struggling doesn't mean they also aren't doing well. You aren't either doing well or unwell. You can be doing well and unwell at the same time. And I think that's a really critical thing for us to really keep in mind as we talk through today's topic, because it'll be focused on where things are not going well. And we should also keep in mind where things are going well, even if it's happening simultaneously.
Absolutely. Yeah.
Yeah, I really appreciate that perspective, Barry. And it highlights for us how important those supports are that also help people feel connected, feel a sense of belonging, feel a part of a community. And, I'm thinking about in a college setting, there may be a lot of opportunities for that to happen. There may be other groups of people who don't have as many of those opportunities, and making sure we're looking for those as risk factors. We do, as you said, the statistics are concerning for changes that have happened in mental health since the start of the pandemic. And of course, it's not only the pandemic, but a lot of other social stressors that have been going on at the same time. And, we're seeing like one figure that really struck me was the number of emergency room visits for suicide for girls in that adolescent age range increased by about 50%. So needing to really pay attention to those populations that are hurting and finding those strategies to build those supportive factors and those factors that help them be more safe.
Yeah, I just want to note that if folks who are listening into this have questions or comments, even comments that you want to share, feel free to share them on our Luba app as they come to you. I think that's easier when it's top of mind to ask a question that's relevant in a moment, and I can pose that to our panelists too. I forgot to say that, but you guys should feel free to do that. One thing that I wanted to ask is whether you think that the issues are actually increasing when it comes to mental health, or is it, people sometimes say, are we just talking about it more? Is the stigma less so that more feel free to think about it and talk about it than they used to? What are your thoughts on that?
That's such an interesting question. We get asked that, quite a bit. And I think different years I have different responses. I think in a way we have talked about mental health as important as physical health as a society. And I think that has actually helped normalize it. I think the pandemic actually, in a weird way, also helped people talk about mental health because people were so open and sharing how disconnected they felt and what that was doing to them. And I think that also helped bring it to the forefront. I think we also know more about what healthy mental health may look like. And also when there are signs of things that are not feeling right. I think that people have gotten much more astute of checking on each other and understanding when there is a problem. And so in a way, it's kind of, we've gotten more astute as a society. And I also think the stigma of being able to talk about when we're not feeling our healthiest also has really, been pushed forward with a lot of great efforts around the community and around the nation. And I think we're seeing some of the fruits of that labor really pay off.
Yeah, I sort of enjoy following you because it gives me an opportunity to say, like, I 100% agree. Yeah, I think that's right on the mark. I would add in a couple of things. One is, yes, we have done a really good job in the last across the last two generations of sort of destigmatizing mental health to the point now that we're kind of suffering the problems of our success, which is now there's simply not enough service to go around because so many are leaning in and doing the thing that sort of the last 20 years, these professions have told people to do, which is acknowledge that you're struggling. It's okay to say that you're struggling. It's okay to not be okay and ask for help. So that's all been really positive, and there's much more talk on campuses than there's ever been. And students chat quickly and early and regularly about how they're doing in ways that when I was that age, we kept to ourselves about these things and just sort of took care of ourselves. One of the things that I do want to point out in all of this as well, and this will kind of be my theme, I think, today, is students, at least in higher ed, have unfortunately begun to confuse sort of what are reasonable responses to difficult things as a mental health struggle, for sure. If one is breathing and paying any attention whatsoever in the last couple of years, it's hard to feel really good. These have been unprecedentedly challenging times. And again, it's not one size fits all. Some have certainly bared the burden of more challenge than others, depending on one's privilege and access to resources and whatnot. But bad things feel bad. It's sad. It's easy to feel sad about things that are sad. It's okay to be angry about things that are angering. And it does not necessarily, once again, mean that one has a mental health struggle. And again, our students have begun to confabulate a little bit the idea of like, when I feel bad, I'm bad, or I'm struggling, there's something wrong with me. And our students really may just be feeling badly about things that simply are bad, which doesn't mean that it doesn't feel good, that it feels good. But again, it's raining. I think we've gone in a direction so far that we're needing to rein back a little bit and remind folks that being emotional doesn't mean you're in crisis. It just may be that you're emotional, and it doesn't mean crisis. And then please don't misunderstand me that I'm not saying that, like, some people do struggle with depression and anxiety and panic and lots of really difficult mental health concerns. But for a lot of folks, a lot of us are just simply feeling really badly about things that frankly are bad.
Barry, are you saying just stress alone is just more amplified, so we're feeling it differently? That's such an interesting perspective. I mean, it really is. I hadn't thought about it that way. That's such a fascinating perspective.
Yeah. In some ways, I am saying, I think it's easy to confuse. Stress has stopped existing, and it's now anxiety. Right? Everything now, I'm anxious, or I got really anxious about something, and it's easy to say, like, I think you're just stressed. Like, relationships make me really anxious. Well, relationships can be stressful. I mean, managing social relationships can just be inherently a stressful thing, and it may not necessarily be anxiety, even if it doesn't feel very good.
Yeah, and to Barry's point, one thing that I find really promising is this increased attention to social emotional learning, starting at the elementary level, so that individuals are having a better, having more capacity to understand their emotional reactions and employ different coping strategies, so they're not rising to the level of crisis, and teaching people at an early age how to navigate what those feelings are like and what we can do is so important.
Yeah, that's actually a great, lead into a question that I had, which is because we're talking about this within the education track, I guess I'm wondering, what does all this mean for the school setting? If students bring mental health issues into the classroom, like, what is that? How does that translate, and what is that meaning for their ability to succeed and learn?
It's so interesting you ask that question, because I'm going to answer it a little bit different way, because we just came from a conference, right? You had 1,800 educators, basically. And one of the core themes that ran through this conference was how the adults in the classrooms are also not feeling okay. It really, really shocked me. My wife is a teacher. I came home and was talking about that. I was really surprised by that. And so when you think about, students who are feeling amplified stress, anxiety, the world as we know it right over COVID changed everything, a terrifying time. Plus, my God, you turn on the news now, climate change along, if that doesn't freak you out too. Like, there's a lot of things that kids are absorbing, but also we hadn't spent a lot of time. And it was really good to hear that sort of conversation around the folks who are with kids all day, who also are carrying tremendous amounts of stress, anxiety, mental health concerns, entering into that space. How do we really help support both? But we have to be honest that it is truly changing the educational landscape, and we've got to get resources so people feel successful. Most of our work is done with the K through 12, and we've done some work with college age students. And again, it feels like there is stress coming from both sides. I'm using the word stress, but anxiety can change interchangeable with anything. But that is all inside of this sort of incubator. And how do we help both sides of that get what they need to be successful?
Mm-hmm. Yeah.
One of the things I'm thinking on these days is there's been some really great research. And again, my purview is higher ed, but you know, there certainly is a pipeline from pre-K through 12 through higher ed. But there's been some really good research. And what they've done is they've asked college students in these research studies, do you feel alone? And so college students overwhelmingly endorse that they do not feel alone. Even during the pandemic, they did not feel alone. They felt very connected, and there was people they could reach out to, and et cetera, et cetera. They then asked the exact same group of students, do you feel lonely? And those same students highly endorse feeling lonely. And so what we've discovered in a lot of ways is that our connections in a lot of ways, especially during the pandemic, were very virtual. They were sort of screen-based. And so something now is missing out of sort of our sense of community in terms of how we make connections with each other, how we reach out to each other, and how we sort of engage in the interchange of emotionality. And I can tell that some people are onto it because I watch the venture capitalists and sort of where they're putting their dollars in terms of creating responses to campus mental health. And the newest trend right now is peer-to-peer platforms. And so the venture capitalists have gotten it, which is their understanding like, oh, this is a well-connected, lonely generation of college students. We probably should throw our dollars behind the idea of creating much more peer-to-peer interaction. And so I think that's one of the tools that we're looking at because staff and faculty, like the teachers are in the K through 12 system, are struggling on their own. And yet we sort of turn either to total strangers through therapy or we turn to sort of like social media exchanges. And what we are understanding is that if we are a well-connected but lonely community, what we really need to do is have a lot more interchange with each other and turn to people we know. And so that's a critical tool we're thinking a lot about is how do we begin to recreate person-to-person, face-to-face interaction with each other and sort of the goodness that can come from that.
Yeah, that kind of makes me wonder whether, because so many people talk about social media or this screen issue. I mean, have you found that that can be beneficial for mental health or harmful, or is it kind of a mixed bag there when we're talking about this?
Well, it kind of comes along like, you know, one piece of candy may be enjoyable, 40 pieces of candy may be too much. You know, like one cup of coffee may be useful, but like 3 gallons of coffee may be not great. And so the research, again, is pretty clear that there's a lot of benefits to social media, but it comes with a negative slant naturally. And so you have to then mediate, like, what are the gains or what are the costs? And we've spent so much time connected to social media that for the benefits we get out of it, we are paying we're paying too high of a cost.
Yeah, I mean, tell me about the costs. Like, what are the implications of too much social media?
Well, I feel connected but lonely. It's that I'm exposed to everything, everywhere, all the time. And that takes a high level of resilience and an ability to sort of screen, to manage the exposure that there is to everything going on in the world everywhere. And then again, social media and media in general just broadly has a negative slant to it. And so you have to manage that. It sort of as a reporting of the negatives mostly, rather than all the positives that occur. And even terms like doom scrolling that students use is just an example of the cost that they know they're paying for the benefits that come for it.
I mean, I think in a weird way, and again, I'm not anti-social media. I think that cat is like out of the bag, right? Like, but I think that over the last few years, especially, I think our understanding of the impact on mental health is really profound. And I'm trying to think of the year, and I know you guys would know it. The study that came out around how young women were being made to feel body image issues. I think it was around Instagram and how the algorithms actually fed into more eating disorders, more suicidology. You know, like we know this, and again, how do we wean ourselves from that? And like you said, finding the good parts of social media, but it's almost an addiction for people, and it's that sense of oh my God, everybody's living their best life and my life really sucks. And how that, you know, then for young people who are still developing, how that makes them feel, which then leads to more feelings of isolation, more feelings of depression. And I don't think we figured out I think we're redefining our relationship with social media and social media companies. And that conversation, but even that study just around the girls didn't get the level of sustained attention you would even think. And so we just have a very short attention span, again, social media, right? Around things because it happens so frequently. But I think it's something we've got to continue to address because it is having real detrimental effects.
Yeah, I was going to read a comment here that we've gotten that is a pretty meaningful comment, and it leads into a good question, I think. It says, I'm a parent of a suicide survivor, and I can tell you that while the openness to discuss is there, the services are not even close, and especially for those who are teetering between youth and adulthood. There is also the mental health of the caregivers as well to consider, and unfortunately, the resources are just not there or available or covered. So yeah, let's talk a little bit about the resources in the schools and what there is currently and what we need.
I think there's tremendous variability is one of the biggest things. When you look at Iowa, there are pockets in the state where there's a lot of resources, and then there are pockets where there are no resources, particularly more rural areas. I think there's a lot of reasons for that. One of the things that I've been facing and trying to work in some of the more rural areas is that sometimes there's also that stigma is still high enough that if a student wants to seek out support, sometimes their families aren't in support of that because of their views of mental health. But also with the variable resources, when you are in a high resource area, those resources are being spread across the whole state. People are traveling to Iowa City from every part of the state or traveling to Des Moines. So that it's clear that there are not enough resources. I do see schools working to really connect more with having mental health providers on site or connecting through telehealth. I think that is, it is a priority. And having to work within the community and the community's values can be a challenge. There's also just not enough people. And that's something that at the Scanlon Center is a high priority for us, is just training mental health professionals across a variety of professions in school mental health, really trying to draw people in for that training, helping to keep people here in the state so that we have more resources. I know meeting with some of the mental health disability regions, they've had to drop services, not because they didn't have funding for it, but because they literally had no people to provide that service. And, I think, funding is always part of it. We have to have the financial resources, we have to have the time set aside to prioritize these needs. But then we also have to have the personnel. And if we're not also tending to the needs of our educators, our medical providers, our mental health providers, they're leaving the profession and we're not retaining them. It's a really complex interaction of effects that are making it hard to access services.
I do think, Alyssa, I completely agree. And I think that what we have seen, and I've been in the state about 9 years, is that school districts are much more open now than they were about having providers and mental health experts come into that space and sharing space to really help their students. And I think that is a big change. It's a very positive change. And so you wind up working really in partnership together to do that. And it wasn't like that before, right? And so again, I think as we have evolved, we are much more open to collaboration. I think it is so interesting because we hear this at the state board level too. People think like, oh, Cedar Rapids, you have so many resources. Yet when you come here and people talk, they're like, oh my God, we need more resources, right? And so it's so relative. But when you hear the rural parts of the state, especially, that it's just service deserts. And we haven't quite figured out yet how to fill those gaps. But those are like really active conversations. And again, and I appreciate that parent who gave us that comment and understand your frustration. And trust me, we are hearing it and we are actually trying to solve some of those issues and figure out how do we screen kids? How do we give parents what they need? How do we use school systems to help deliver those services? How do we get more providers in areas where there are service deserts? How do we utilize telehealth? But it's such a complicated web. And so it's kind of peeling back the layers of the onion. And depending on where you live in the state, the response, like Alyssa said, is going to be very different. And so we're trying to make that a little bit more uniform, and it's tough. But there are real gaps. And I think that's part of it too, is just that being able to admit that there are areas we know we are still falling down and we have desperately got to get better.
Yeah, I guess I'm wondering, like, what does having mental health resources really look like? Like, what are we talking about? Are we talking about people who are going into classrooms and like talking to kids? Are they just there if kids need them? Are they being proactive? How do they engage with parents? Like, what does it actually mean to have resources?
I think that's a great question, because I think it's easy to get stuck on, mental health is going and seeing a therapist or going and seeing a psychiatrist, but there is this broad continuum of services that we really need to be thinking about, starting with, universal screening, so we can identify, we're pretty good at identifying kids who are having externalizing challenges and having big behaviors, but kids with internalizing challenges, they can be very hard to identify if we don't have a way of asking questions and being direct and being able to talk about depression, suicide, if people are having thoughts. So, it starts at that level. It starts at the level of modeling what self-care looks like, what are the coping strategies that we can use to manage distress. It includes having connections with the mental health professionals that are part of the school system, whether it's the school counselors, school psychologists, school social workers, some of those hired by the schools, some of those working for the area education agencies, and then also people who are contracted to come in and provide support. And then how do those different groups work together? So one challenge I hear is schools may be able to hire a social worker to come in and provide therapy, and then they don't have any funding to allow for time for coordination of those services. So a student comes in and meets with a counselor, and then there's no ability to kind of talk about what that student needs in that setting to thrive. And then this goes all the way up to, inpatient hospitalization and coordination of those types of services that are incredibly in need. We just do not have enough beds. We do not have enough providers. We do not have enough resources for those individuals who need high level of care and then need support coming out of that care and reintegrating into the community.
Right. I know at the higher education level, like the University of Iowa, for example, has been embedding counselors into residence halls and into specific colleges. Have those counselors been used well? Are they busy, or like what does that look like today? Because that started a few years ago, I know.
Yeah, good memory. Yep. So that is true, is there has been embedding of therapists across different areas of the campus just to sort of open up greater accessibility, especially for those communities that may not have the time to get across campus, or, might not sort of enter into a building they're unfamiliar with to seek services. And so by making things more accessible, the hope is that folks will access services more. And that has simply been the outcome, to the point that the University of Iowa, as one example, simply just continues to find itself in bottomless need with finite resources. One of the comments that you often hear on campuses is you can't hire your way out of this, right? Hiring more professionals does not necessarily sort of solve the concern. Maybe more people will seek out services, but in the end, it doesn't necessarily meet the bottomless nature of the need. And so we've discovered we can't hire ourselves out of this concern. And so one of the things that we're seeing on campuses, which I think is a really positive movement and has been talked about for decades, but really there's movement on it now, is that in some ways, and hold in here with this discussion, is to decenter mental health out of the conversation and look at people sort of from a more holistic well-being perspective. That mental health is just a piece. Like if I'm doing pretty well, but I'm not sleeping regularly, or my sleep is highly disrupted, the chances that my mental health is going to be good is probably not going to happen. Or if I'm not eating well, or my social relationships are disrupted, or I'm in financial woe, or I've had a lot of losses due to COVID and whatnot. And so campuses are finding themselves now sort of expanding themselves out and taking a look at students, not just from a singular mental health perspective, but holding a larger lens of well-being. There have been a couple of really good studies that have taken a look at sleep amongst undergrads. And what they basically have discovered, and the results of a number of these studies is that if students slept more regularly and consistently, about 20 to 30% of them would stop going to counseling immediately. And so there's a coding of like, I'm not feeling well, what's wrong with me? I need to see a professional, and not the idea of like, on those key elements of sleep, eating well, exercising, and social relationships, and not attending to those. And I think the problem is me. It's probably a lot of just readjustment in that larger well-being portfolio that we each hold. And that a lot of that readjustment would sort of handle some of the mental health concerns that go on. And we decenter mental health out of this and take a look at people more holistically. And so we're seeing a lot of that movement, which is drawing in a lot of folks who are not mental health professionals to handle and take a look with folks from a larger well-being perspective.
Barry, you just laid out what almost all of us should be doing, just for the record. So thank you for that. But I want to go back to something Alyssa said too, just about all those elements around mental health resources in school, and I do not disagree. The one element I just want to highlight, though, is that the culture of each institution is really, really important. It's one thing to have resources in a school, in an institution of higher learning, but if the culture is not responsive to helping bring that expertise to the table and how to effectively use that expertise, then it is not going to be successful. And that is really, really an important element of how because each school is very different. Each school has its own culture, its own norms, its own ways of doing things, and how that gets incorporated and how those resources get incorporated have to be a very important part of that discussion.
I'm really glad you shared that, because one of the things that I think is most exciting that I see happening in schools is this focus on culture and climate, and thinking about our disciplinary practices and thinking about how we're talking to students, and turning to a more trauma-informed lens, and what allows people to feel safe, like looking at behavior and recognizing some of these behaviors make a lot of sense if you look at what's happening for this individual who feels unsafe in this environment. They may be acting out, they may be fighting, they've got their whole fight, flight, or flee, activated because they don't feel safe. And if we come in with highly punitive, reactions, those behaviors just escalate. And then we have, we may label it a mental health issue or a behavioral health issue, when really, if we can think about just how we're connecting as a community and listening to one another. One of my colleagues, Dr. Jamie Elizalde, is doing some really great work where she's taken DBT, which is a therapy intervention, taken skills from that, and has been working with schools and some of the AEAs in the state in how to implement some of those, the philosophy and practices, so that we're building that community in the schools and people have common language to de-escalate situations and invoke wellness. And so I think, in Iowa City, they've been doing that for a few years now, to the point where they even have an elective coursework that some students can take just on learning those skills. And so I think that shift where, we're looking at wellness as a primary piece of education is really critical.
Yeah, one commenter just sort of made a note that they felt that there were plenty of resources at the younger levels, but things got kind of harder as they moved into junior high and high school. Is that something that you guys are seeing? I mean, are we working well with little kids and it gets more difficult as they age, or what's the landscape there?
I don't know, because we do a lot of play therapy at Tanager. But we also have a lot of embedded therapists in high schools and middle schools. And I think it just the issues become even more complex, right? And so, I think Barry or Alyssa, one of you had said before, is also finding the right people to fit the population of young people. I think sometimes we have this idea that just a therapist can just get plugged in anywhere, but therapists and mental health professionals all have specialties and also know different populations that they work best with. And teenagers are going through so much. As you get older, young adults going through so much. And so having a talented pool of professionals that can work with that population, absolutely, it matters. But it's changing that mindset that, oh, I'm a therapist, I can work with anybody. It doesn't work that way. I think we watch too many movies and TV, and that's what it appears sometimes, but that's not what it's really like. And so, again, you want people to be connected with someone that really understands them and their complexity. And so we're trying to continue to hire and find people who want to first of all, do this work, and also match them with where they feel they're going to be the most effective. But the workforce absolutely plays into this.
Yeah, I think it also may depend on what the needs are. So for individuals who need very high level of need, as they get older and bigger and stronger, sometimes it's harder to manage those needs. And then it may be much more difficult to access those supports. So I think we also recognize that transition time. So as students are moving from childhood to adulthood, and there's this natural transition from providers who work with children to providers who work with adults, there can be gaps and people can have difficulty making that transition. So I absolutely hear what the person who asked the question is saying. I've heard that from lots of folks. And I think that's a gap that we need to address. And I think, as Akpara is saying too, is we need to have a better recognition of what services in particular are lacking for these different age groups, because we also hear sometimes for the younger kids, services may be lacking because people don't know how to work with the very young children. So I think there are needs across the age spectrum, and I certainly respect the experiences of the family members commenting.
Yeah, and actually your comments lead into another question we received that that asks whether you guys are going to be, or whether people in general schools are looking to obtain more therapists for people with actual like developmental and cognitive delays beyond just those experiencing anxiety or whatever. I mean, is that something that we're in need of as well, in terms of more resources from both that sort of special education standpoint as well?
Oh, I mean, I would not argue against that. I think if you hear, one of the things with the Children's State Board, when you hear parents talk about the struggles they have and the struggle of accessing services, what became very clear is that there are a wide array of complex needs that are out there. And it's very difficult. Again, we talked earlier about depending on where you live in the state and what resources are in your community, it feels like you don't have enough, you don't have the right resources at the right time, or that the continuum feels like there are huge gaps in it. So I don't argue that there is a need there too, but I think it's having that comprehensive view of wherever you live. And I think the regions are doing a very good job of this too, of looking at what are the areas where we know we have major gaps and trying to really plug those holes. But that's very, very difficult to do, because even if you have a hole, it doesn't mean you're going to have a provider that's going to fill that hole, right? And fill that gap. And so then you're trying to go to plan B and plan C. And that's where it becomes, and this is where I feel so deeply for parents, because they are caught up in the system trying to figure out how to fix itself. But they just have their child that just has needs, and they're trying to get their needs met. And that becomes very, very frustrating. And that's a part of the story that's very hard to hear, and it breaks your heart. But this is why this is so difficult, to try to fill those gaps. So I would absolutely, we know there are needs there, but again, depending on where you live, the response could be very different.
Yeah, absolutely. And because this is a solutions-oriented conference, I guess I'm wondering if you guys, because a lot of people who are listening in aren't administrators, they're not educators, but they may be parents or people who are wondering, like, are there things that you as the experts would say that parents or just members of the public can do to help with these issues, with providing mental health resources for their own kids, for other kids, even if it's advocacy? Like, what can people do you think?
I think a message that, I heard from Akpara here is that there may be more resources available than people are aware of. And some of that is a communication barrier. So being aware of who is it in your community that you can go to find out about resources, whether it is, somebody in your school system, somebody from the medical system, reaching out to the mental health disability regions, to make sure that when the resources are there, we are accessing them. And then also going back to the focus on workforce development and making sure that we are continuing to train people who have both generalist knowledge to work with a broad range of people, but then also specialists who really understand, the intersection of mental health and developmental disability, or who really understand certain age groups or certain diagnoses, or other populations. I had another thought and totally lost it, so I'm going to step back for a moment.
I could offer a couple of things while you see if you can recall that. One thing is, I was at the conference that was being mentioned, and while I am higher ed, I was spending a lot of time with pre-K through 12 folks who often had the language of like lack of resources in our community. We're a small town. We don't even have a grocery store in our county kind of situation, let alone all these mental health folks. With the advent of telemental health and sort of just the wide availability of it, one doesn't need to have a resource person in your community anymore to be serviced by that resource person. You can be living in Sioux City and providing counseling services to Davenport. And so this telemental health platform, and the research is good on it. It's been very consistent for the last decade or more that the benefits of telemental health are as good as in person in a lot of ways. And it comes down to expectations. What are the expectations of the receiver? But if expectations of this is the service I have and I think it'll be helpful to me, then the results are equally as good. And so that's a thing for us to keep in mind, is there is now a open access across the state, and one does not have to have a provider in geographic place to get service from them. The other thing, this is a much larger thing, and I don't know the entire answer to it, but it's common that I see it, which is there clearly is a high value of mental health right now. It is a high value. What continues to be missing is a valuing of that value. So we talk about the importance of mental health, but I sort of know what social workers' salaries are when they start at places like the University of Iowa or a school district or potentially even Tanager Place. And I don't know the salaries there, but I probably could have a sense of that. And so we are grossly underfunding people that we think are so high. They're highly valuable people, but we don't value the value of mental health. And until there is a change in that, where we sort of hold the practitioners of mental health services in a higher esteem and fund those and resource that, we're going to continue just to have this dearth of services, because the demand is so high and the services are so critical. We've heard in from like a mother who said, I'm the mother of a survivor of suicide. The needs are high. And so we're asking practitioners to do a lot of work. And what we don't necessarily do yet is value the value that we have around mental health to make that a much more attractive profession for people to go into and stay in.
Yeah, I wouldn't argue against that or anything you and Melissa said. I think as you look at solutions, I would just really say to folks, use your voice. I think that sometimes people don't realize the power they really have. Been in a lot of meetings with legislators and policymakers. First of all, we really do have access to them in this state. I think that is one of the unique things about Iowa, and having lived in multiple places in the country. But I can tell you, I can go up and say something, they can listen, but when a parent comes up and really talks about what they are going through with their child, it has a completely different impact. And that is often what really moves the system the fastest, is using those stories and that voice and having the strength to get up and speak. I cannot stress that enough. And so I just really tell people, advocate as much as you can, hold us accountable, hold systems accountable for our failures. And I think that that's what's going to move the system, and it's tough to do it. And we understand it's hard and it sucks sometimes to talk about things that don't go well. But if we don't talk about those things, we're never going to get to real solutions. And so I just think advocacy is a huge piece that plays a part in this, and that you have a voice and you have a lot of power, and collectively we can move mountains. And I think we're starting to have some of that. And I think people are being so much more candid about their stories and sharing and being vulnerable. And I think it is making a difference. I really do.
And I would
go ahead. Sorry.
And I was going to say, and I would just tack on, don't be satisfied by the talk of like the high value of mental health, because you've got to push forward with your voice and the advocacy work to ask that we value the value of mental health. And those are two very, very different things. And we can often be kind of wooed by the idea of like, oh, there's a lot of talk about it and it seems important. But until we sort of throw the resources at it, we're simply not valuing that value.
Yeah, well, and so one topic I wanted to ask about, which is it's a difficult one, but I feel like there's been a lot of news and discussion lately about suicide and suicide ideation at the younger level. Is that something that you think is becoming more prevalent, that kids are dealing with more often, that families are dealing with, or is it just that we're hearing about it more, and why, if so?
I mean, I would answer, a couple ways. One, I don't think we hear about all of it. So we hear about some. I think actually a lot of it we still don't hear about. But I think the data is showing that it is trending in ways that are not, no one will be pleased about. And it was years ago, this is probably maybe 7 years ago, I had read a study from Nationwide Children's Hospital out of Columbus. And I'm the father of 2 sons. And this study talked about kids, African-American kids in particular, ages 12 and younger, and how the rates of suicide were literally outpacing their peers of different races. And I was so horrified. And I was like, oh my God, I've been in the mental health field for so long. How did I not see this? And how have we not been discussing this? And so I do think there's a lot more data that's there, but I don't think, and there's this fear, and I would look to my colleagues because I know who they live in the space, even more with the research, is I think there's a fear of talking about it because of the contagion factor. And so we don't tend to have these conversations, but the data is there, and we're seeing it. And I think that we are talking about that. So it is a major problem.
Yeah, the data is clear that suicide is increasing, and certainly for some groups more than others. So you mentioned African American youth, LGBT youth have an incredibly high rate of suicide. I know I wrote down a couple statistics around this, and right now 1 in 13 Iowa high school students has attempted suicide 1 or more times. Suicide is the second leading cause of death among adolescents in Iowa. Like, these are figures we can't ignore. I think you hit on a really important point that there's still fear that talking about suicide will cause that thought to come to someone. Like, they wouldn't consider suicide unless someone mentioned it. And that's not what the data shows. Research on suicide prevention absolutely says we need to talk about suicide. We have to sort of demystify it. We need to ask directly if we're concerned about someone, express our concern, ask them if they're having thoughts of suicide, having thoughts of ending their life, having thoughts of killing themselves, being very direct in those questions, and that doing so really can save lives. And so I think having more education around how to talk about suicide, how to ask about it. And what we're seeing a lot of is our young people may say something to a friend or text something or post something on social media, and their peers have this information and are wondering what to do. They may be, are being told, don't tell anyone, but I have this fear. And we've seen, I had a friend recently tell me a story. Her daughter got one of those messages, went to her parents contacted the other parents, and were able to intervene. Teaching our young people how to respond when they hear those comments from their peers is so critical. And so I can't say that enough. And then I'll just touch on, the talking about suicide and being able to limit access to means are some of the top ways that we can reduce suicide.
I think that's all so well stated. Yes, access to means is such a critical thing. I wanted to share a statistics as well. At the counseling center here at the University of Iowa, and again, this is not unique to Iowa, there's a screening tool that students complete every time they come in. And one of the questions that it asks is, in the last 2 weeks, have you sort of thought about suicide on a scale of 1 to 4? And any given week, around half the students that come to a counseling center are going to endorse at least a 1. So half the students that come to the counseling center on any given week are endorsing at least a 1, if not more. The other side of that coin is the vast majority of those students are never, ever going to act on those feelings. And why is that? Well, because of protective factors. And so that becomes a really critical piece of this equation as well, is we have to look at risk, which both my colleagues have talked a lot about, which I really appreciate. And protective factors are such a critical thing, which is the reasons that keep me in check, or those things that keep me grounded, or the things that even if I think about it, I wouldn't act on it because. And one of the critical things that we know that serves as a protective factor is I believe that I'm part of something bigger than myself. And so when we sort of think about loneliness and sort of like, high comparative social media and all the kinds of things that come with that, where I don't actually necessarily feel I'm part of something bigger than myself that's positive, that is such a missing key factor. And I think is one of the reasons, and the research is beginning to bear this out, why we're seeing such huge increases on sort of teen and adolescent suicide, is because that major protective factor of feeling like I'm part of something bigger, positive, bigger than myself, is increasingly missing from my portfolio. And so I think that's a really critical thing, is student involvement and sort of real, actual face-to-face things make such a difference. Whenever I see a college student on this campus sort of like walking to the football game, wearing their black and gold and yelling, "Go Hawks," that's a thing. It sort of seems like it's ridiculous in passing and blah, 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 go Hawks. But what it sort of is elevating is the idea of this is a person who clearly feels they're part of something bigger than themselves, and they have a positive affiliation with it. And that's a major, major protective factor.
Yeah, gosh, that's so helpful. I mean, hearing about the protective factors and just, also about the need to talk about it, I think is really, and I guess I wonder if that translates to other issues as well. I mean, I know that at a young level, talking, like I think there's the idea of if you just don't talk to small kids about racism or something, it'll never occur to them. But it's like, obviously teaching kids how to be an advocate, in that area is an important thing. So I guess I wonder if it translates to mental health as well. And I wondered if we could talk a little bit looking forward into the future, like, the peak of COVID lockdown is over, but obviously sort of politics never end and social media is still here. So, right, exactly, cross your fingers. I guess where do you guys see this issue going forward? Are the stresses continuing? Do you think the attention is helpful?
Well, that's a great question. I think, for me, I think it's always going to be something that is going to be focused on, first of all. I think as we look at the next 2 and 3 years, and I just want to go back, the launch of 988 and the data around people calling has been also incredible. So just everybody watching and listening, 988 has been a game changer too. So that the people who are in that, feeling that vulnerable in that moment, they do have somewhere to turn to. And so there's a big push there. I just want to talk, just highlight that. I do think from a systems level perspective, where I spend some of my time, I think that we are getting much more targeted to where are those gaps for families and for young people. And I think that is a very exciting part of this conversation over the next few years, is that we are looking at, all right, can we think of innovative approaches to address these issues? And I think bringing multiple folks to the table, multiple collaboration, even using some of our for-profit partners to go along with the state, with nonprofit providers, I think that is going to really sort of take off to fill those gaps, and looking at, do we need to have urgent cares for behavioral health for children, right? We have the access centers for adults, but that doesn't really fit kids. Those are some of the exciting things. Are there ways to design programs that are really specialized for certain segments of young people that need certain type of treatment? That's also very exciting. So I think that we are getting much more from a generalist kind of perspective around mental health, and moving toward much more specialties, and also gap filling, and then also going and finding the workforce to help fill those gaps. And so I think from the systems perspective, I feel like things are moving forward. We're figuring out the funding, the braiding, the regions, the state. And so that part actually feels like, hey, we've got a little bit more momentum, and everybody is coming to the table saying, hey, we're going to put our interests off to the side and work toward the better good. Not saying it's like we're all singing Kumbaya down the hallway together. Not there yet. But we're at the table together, and there's some respect there. And that's how you start to solve real problems.
Yeah, I love that you mentioned 988. And I think I also want to, mention in Eastern Iowa, we have Youth Mobile Crisis, which is increasing access for those, 24/7 or emergency services that are needed immediately in schools. I'm hoping that as those things are sort of starting up in some areas of the state, that they will expand and be available statewide. The other piece, as we're talking about filling gaps, I think what I'm hearing is also more of a desire to collaborate. So I think a lot of things have been siloed. There's education, there's medical systems, there's mental health, there's families, there's community centers. And I'm hearing more and more interest to collaborate and work together and provide a community of support in order to fill those gaps so that they're not so siloed.
Yeah, brilliance. I'm sitting on the shoulders of brilliance here, and don't have too much more to add because I agree with all of that. The one additional thing I will say, and I think the University of Iowa has done really sort of a really bang up job in sort of moving a massive long-standing system, is the university has done a really good job of decentralizing the police out of mental health. That sort of was the key response group, was the campus police was the response. And the university has done, again, not defunding the police in any way, but simply decentralizing them out of the mental health response and leaving mental health response up to mental health professionals. And so one of the things the university has done, which I think is brilliant, is they have started what's called the University of Iowa Support and Crisis Line, which is done through community here at the in Iowa City, but is available, community response nationally and as part of the 988 network. But they've started a brand new line, a hot and warm line at the University of Iowa that students can call 24/7 if they're in crisis, or they just need support, right? It's hot and a warm line. No reason too big or too small to call. And then that service can activate things like mobile crisis or the access centers or whatever other services in sort of our community that exists. But these systems can be set up anywhere within the state that then can access additional services either within that community or statewide. And so the decentralizing of police is then pushing kind of like a greater sort of growth of a mental health network where mental health folks are responding to mental health issues. And I think that's just been a really good system change really quickly in terms of culture change.
Yeah, and we're about out of time, but would someone quick tell people who don't know what 988 is?
It's the national crisis line for suicide and mental health crisis.
Yeah. Okay. Yeah. Just want to make sure in case people were in the dark on that.
Yeah,
So thank
instead
you
of
guys.
911, you can dial 988.
988. See, there you go. Well, this was a really informative conversation. I'm really thankful for the people who chimed in and asked questions and made comments, and for you three, of course, and all of your insights and expertise. So thanks again. I think our next education session later today will be on liberal arts education and kind of the changes there of enrollment, et cetera. And then we have one on diversity tomorrow that you can tune in on. So thanks again for everyone for listening in and being here. And thank you all again too.
Thanks so much,
Thanks to my
everybody.
colleagues.
Thank
Thank you, Vanessa.
Thanks.